we're going to give our briefing now, and fortunately, in some ways, we don't have a tremendous amount of information to give you, but in other ways, we have some not very good information from the standpoint of our nursing home. Our nursing home in Monongahelia County that Dr. Smith is heading up the charge, as far as our testing and different things that are going on there and everything. But we sent our National Guard up. They did a bunch of additional testing. They went the night before last, and I think that's correct. And they did a bunch of additional testing or assisted with the people that were there. We do have a total of now 4 residents that have tested positive. And we have at least 2, and we could have the possibility of 3, of staffers that are working there that have tested positive as well. That's really concerning from the standpoint of the reason, I guess that probably led the way for reasons. Now, there was a multitude of reasons, but that was surely one of the reasons why, I guess the biggest reasons why, that we moved forward with the stay-at-home order. It was, it's surely concerning when you have community transmission, and that's what we've got going on right now. All of our health teams are working in every way to ensure those that are in that nursing home as well as those that are in other nursing homes. I've said it many times. It was the very first thing we did, and we did it proactively and in hopes of being able to keep this completely away from our nursing homes. I thank God every day in the world for the fact that we did it, and we did it long ago when really it was meaningful as far as stopping visitation to the nursing homes. Really tough thing to do. I mean, when you tell somebody they can't go see their mom or their dad, I mean, that's tough stuff. And, and it's really meaningful to those that are in the nursing homes to be able to get those visits. And so it was really tough, but I think really and truly we made the right call there. As far as, those that are applying for unemployment, we're processing those claims with light speed. And yesterday we processed 7,000 claims. We're trying to get all the red tape and all the regulations out of the way to be able to get funds immediately to our people. I'm really pleased with all those that are working to get that done. And as far as our purchases, I think the general is going to comment on a whole lot, on the purchasing of supplies and the fact that we've formed this strike force that's working on it around the clock. I'm happy that there's shipments that are going out right now because stuff has come in. The last thing I want to, let me do one other thing. I'm saving, to tomorrow being our day of prayer statewide in West Virginia, but let me mention just this. And this carries with it a lot of notoriety, and I'm really proud of this and everything, but the Milam lab right now is pumping out, one of the drugs, and there's no point in me, I'll try. It's hydroxychloroquine. That was pretty good for me, but that drug really combated malaria. And we found, that it may very well be one of the drugs that gives us a breakthrough as far as stopping this dreadful disease. And so with that all said, we should all be really proud of Milan, and they're the first, I think, in the country that's now manufacturing this product and everything, and it's right here in West Virginia. So, Milan, we're really proud of what you're doing, and we really thank you in every way. And I couldn't be more proud of the fact that you're from West Virginia, so that's good stuff. And now the last thing I've got is just this, is tomorrow at 12 o'clock, we're going to have, our statewide, day of prayer ceremony. And at that time, I really urge everyone to kind of, to watch it and everything, and surely pray with us, you know, God above will hear us, and he's hearing us in every way, shape, form, and fashion now, and he'll hear us. And so you know, and he will be the one to get us through this. And so I would tell you, you know, we're going to try to have 2 or 3 songs, you know, from different groups and everything, and many, many different pastors or ministers or bishops or whomever speak. We will welcome all denominations, all of us. You know, in this state, we're all one. There's no place anywhere for discriminatory actions towards any of our people in any way, and their choice of worship and everything. And so we're all one. We should be immensely proud of that and everything. And so tomorrow, if you would, you know, if you could tune in, we're going to do it at 12 noon, and it'll be virtual, you know, and our people are putting it together high-tech wise beyond me. So from that standpoint, that's all I've got for the day. I just end by just telling you this. These words I've said many, many, many times, you know, to not panic, to be cautious, to not be fearful, to be smart, to not be weak, and to be West Virginia strong. It sounds like simple words, but really and truly, at the end of the day, we're pushing the right buttons to keep this thing, you know, under control and away from us. You know, if we just think back about New York just for 1 second and everything, you know, there was a lot of buttons there that maybe weren't pushed the right way and pushed early enough, and they've got a mess on their hands, and we don't want the mess here. We're trying every way in the world to keep it out of here, and we got to remember just this, and then I'm done, and it's just as simple as this. We are the highest risk state of all. Don't relax. Don't go into crowds. Do all the things. Wash your hands. Stay at home as much as you can. The sun's shining. We're better off today than we were yesterday. And if we can get more days under our belt soon, we hope and pray in every way, shape, form, and fashion this will pass. So God bless you, and now I'll turn it back to our narrator, whomever it may be.
Ladies and gentlemen, as part of our briefing today, our friends with the media are once again joining us by teleconference. We'll be taking questions in just a moment, but first we're going to take comments from a few of our panel members. First up, General Hoyer with the National Guard.
Good afternoon. At the direction of the Governor, National Guard continues to function related to 4 lines of effort. Operationalize the event, meaning that this is a public health emergency that our nation and our states have not experienced before, and the effort needs to be put in place to help our public health officials be able to operationalize activities for a major public health event like that. That includes embedding assets in the Department of Health and Human Resources for Secretary Crouch and Dr. Schlempp to be able to more effectively do the missions that they need to do to address this, along with a relationship with Dr. Marsh to be able to manage data analytics and other things of that nature to help us address the threat. Stabilization of the population, as we all know, over the last several days, the Governor has placed great emphasis on us making sure, in particular, we provide support through the tourism folks as well as the Department of Education, our county boards of education, to ensure that our children who are at risk as well as our seniors are addressed and taken care of. Working with those folks and the food banks, we will continue to build out a plan to sustain support for our vulnerable population. Included in that is working with retailers and others to help with prevention measures to ensure that we continue to maintain the appropriate facilities and supplies necessary for normal daily life where possible. The next is logistics and critical supplies. As the Governor mentioned, he directed the National Guard to establish both a consolidated supply center for all the supplies for Department of Homeland Security Emergency Management as well as DHHR. We have a team embedded and working to ensure that those things work effectively. Supplies have gone out today, and we continue to receive supplies in, but as the Governor has mentioned before, there is a national shortage of supplies, and we, along with other states, are working hard to identify where resources are available to address that as possible. The last is intelligence and data analytics to help Dr. Slimp, Dr. Marsh, and the key people to have the information they need to make good judgment and decisions and provide the best information possible to the governor to address the movement going forward. Later today, there will be a press release going out from the National Guard that will lay out more specifics in detail of the things that the governor has directed us to do and we are working on with various organizations across the state. Thank you.
Thank you, General. Up next is Dr. Clay Marsh. Okay, we'll come back to Dr. Marsh. Let's go to Bill Crouch and Dr. Slimp.
Yes, let me talk just a minute about where we are in West Virginia and where we are in the country. These are not normal times. I think I said yesterday that we have a point of reference for this. It's a pandemic. It is a fast-moving disease, and it's very stressful. There's fear. There's a lot of worry. We have folks who are worried about bills, worried about medicine, worried about food. It's an emotional time. We need to help each other. We need to help each other cope. If you need help coping, there are avenues for you to do that. Our local behavioral health centers in West Virginia are there. They handle regions of the state. Call your local health department to get a number or go to our website to get that number. CDC also has information with regard to coping and dealing with anxiety in these times. So please reach out to support each other, help each other, help your families. So.
Great. Good morning or afternoon. The days fly. And thank you. First, I want to say just my appreciation to the Guard and to many other partners who really offer their assistance. This is absolutely something that we do as a whole of government, whole of community, that is absolutely critical. And so I so appreciate all of their assistance.
Can you hear me, Jordan?
I wanted to talk today a little bit just about, as a family physician here, to address folks' thoughts about if you think you have coronavirus or you have gotten tested and are awaiting your test results, or you've been diagnosed with it, what do you do? And so I want you to think about it from the moment of when you have a flu-like illness, you take care of yourself at home, you do measures to prevent spread of disease, you go to the doctor's office if you need health care, but you don't have to go every time, you don't have to be tested every time, and then you work your way through it. So with this disease, it's going to be very similar often. So if you are awaiting test results or you are thinking you might have this or you know you have it, you want to treat it as if you do. And so what you do is first you stay home. And you are very definitive about staying home. If somebody you need to go to the grocery store, somebody else goes for you. If you go to the pharmacy, you want to not be around other folks. You want to separate yourself at home as much as possible from others in the household. So if it's possible to have your own bedroom or a bathroom, you use that as well, so that you don't spread it to family members as much there. You can, if you need to go out and be around people, you can use a face mask. Folks are actually making some wonderful ones in communities. That's a great use for those. If you have to be near somebody else, you're welcome to use that. You want to do all those good hand hygiene, other kinds of things to not spread it in your household. You want to not share dishes and cups and all those kind of things, and to clean, good environmental cleaning. You monitor your symptoms, and if you're getting sicker, you want to talk to your healthcare provider. You call them first, tell them you think you might have this, and get their guidance on what to do. If you go to the doctor's office, you want to wear a face mask when you get to the doctor's office. And so most people will get through it this way. And so what you want to know is how long do you continue doing that? And when can you go back to work if you're an essential employee? When can you do those other things around your family that you want to be in close contact with again? What you do there is you want to isolate yourself, essentially stay home for until you have had at least 7 days. and at least 3 days after the symptoms begin to resolve. They're 3 days after fever is done. So, but always at least 7 days, and at least 3 days after fever is over, so maybe longer than 7 days. So that's kind of how you handle this. And if you have family members that have been exposed to you, you actually ask them to stay home with you as well, so that they're not transmitting it further. And that would be for 14 days, actually. We have this on the website. We have a couple of new information sheets for folks on the website if you think you might have this disease, how to handle it, and also if you think you've been exposed. So I just want to give people the practical pieces of how to handle that as we move forward.
Okay, thank you. We're going to try Dr. Marsh again. Dr. Marsh, if you can hear us, go ahead.
I can hear you fine. So it's great to be with you guys. And what the update that I have is about the U.S., about New York, and then about us. So the World Health Organization has identified the United States as the potential next epicenter of this COVID-19 or novel coronavirus infection. And what New York City has experienced, as the governor talked about, is that they have about half the number of total cases in the United States right now. When you look at the United States and when you look at the death rate in New York City, though we've been able to keep that around 1%. Around the world, the average death rate in the novel coronavirus is about 4%. So ultimately, we want to keep the mortality rate down in the U.S. And for us in West Virginia, as the governor did yesterday with the new legislation and the ability to reduce the number of people at work, and the number of people that are interacting outside, as Dr. Slim said, that we hope that we can be a beacon for others in this country. And I think from the data coming out from China and the data coming out from many other countries that have successfully dealt with this virus, it's clear that taking this very seriously, staying in your house as much as you can, making sure that you don't put your hands around your face, wash your hands frequently. If you touch something out in public, a doorknob, a counter, elevator button, if you're going somewhere, then don't put your hands around your face and wash your hands. Because it's clear to me that a greater and greater way that this virus spreads is through droplet. It gets deposited somewhere. And we know that on cardboard, it can live for up to 24 hours, on plastic and stainless steel, maybe even longer. So instead of trying to clean everything all over the place, the idea is take care of yourself. We have great power. We need to use it. And in your house, for areas where people touch and people from outside might come by your doorknob, then you can wash it off with soap and water or some disinfectant. Governor Justice has made the decisions, and certainly with the advice of the medical community and DHHR, that I believe that we're doing the right things for the state of West Virginia. And as we have the most vulnerable population, we also have a great opportunity right now to take the tsunami wave potential that New York City has seen and reduce it not to a river, but to reduce it to a stream. And with everybody in the state working for their neighbors, for their family, for the vulnerable people in the state, and for our heroic healthcare workers, we can be the state that had the least impact of coronavirus from anybody else. Thank you.
Okay, thank you, Dr. Marsh. Once again, Governor Justice and our panel members are holding today's briefing with media members joining us virtually to practice good social distancing. To ensure all outlets have an opportunity to ask questions, each outlet will be given the floor to ask one question on our first run through. The order has been selected at random. Media members, when we call on you, please.
All right, we have been watching a news conference with West Virginia Governor Jim Justice. Remember, the stay-at-home order goes into effect tonight at 8 o'clock. He talked about how there are 4 residents and 2 staffers at a nursing home in Morgantown that have tested positive for coronavirus. Again, the stay-at-home order goes into effect tonight at 8. We've got the...
Harold Dispatch, can you hear me?
Taylor, talk one more time. We can hear you.
Okay, I'm here. We good to go?
We're good to go.
Okay. I was wondering, as we investigate how the virus entered the nursing home, how important it is to find how that got spread and kind of how do you pinpoint and really investigate, get to that final point of how it got there and how important is that in the investigation?
Nursing home outbreaks of disease are not new, and this would enter a facility the same way that that other traditional outbreaks of flu or other diseases enter nursing homes. You know, you can do lots of things to minimize introduction of disease into a nursing home, and they've been doing tons of that, which is great. But we still have, you know, staff, essential workers coming in and out. And when you have to, and they're taking lots of precautions, but clearly at some point, something had to occur that allowed the entry. We don't necessarily always track down exactly what it was. We want to make sure that we understand who is in the facility that is infected and how do we manage it now, and then make sure that we have all the precautions in place to minimize future issues with that. So the focus is really on managing the folks that are ill, identifying where else is in the community, in the facility, reducing any further spread in the facility, and then making sure there are things in place that keep that facility as safe as possible in the days to come.
Let me say one thing on that too. Initially, upon the advice of all the healthcare community, we got to pass a few accolades towards all those that were the people that operate our nursing homes. Mm-hmm. They all came. They all came. We all met. Every single one of them was advocating, you know, to not let visitors in the nursing homes. You know, I surely brought up just this, and this was a real concern, is just how staff moved in and out. And there's all kinds of precautions that I'm sure that a lot of people are taking and everything and doing great work on. You know, however, I don't know how we can be even too cautious. And we have got to remember that this disease is trying every way in the world to strike our elderly. And we need to put up every firewall we can possibly put up. We're doing it. And but just remember that's the one, that's the target, that's the bullseye of this disease, and it's going after our elderly.
I really do have to promote and say how seriously our long-term care industry has taken this. They were very proactive with this. It really is, you know, with this situation, you've got a disease that you can have very, very mild symptoms. You might not have a fever, might not recognize you were getting sick, and so it's easy to unintentionally, with all the right precautions in place, to introduce something. So all of these measures that we put in place are to minimize the risk. It can't actually always eliminate it.
Sure.
Okay, thank you, Taylor. Up next, Stephen Allen Adams with Ogden.
Yeah, this is Adams with Ogden, and I have a question. The first part of it is this. I know you just said we had, as a state, had received about 7,000 applications for unemployment compensation benefits. First part is that on top of the 17,000 that you had said we had received as of yesterday, between Tuesday and yesterday? And part two of the question is this. I see where Ohio has been told by the Department of Labor to specifically stop announcing daily numbers of unemployment compensation benefits. I'm curious to know whether the state has received a similar directive to not announce those numbers. Apparently they want those announced weekly versus daily, and I'm thankful that you are giving the numbers daily. It's helpful, but have you received any direction from the Trump White House or the Department of Labor on that?
Let me jump in first, and then Brian can follow behind me and everything, our counsel. But what I said before, Stephen, was 7,000 were processed yesterday. You know, there's a great many more than 7,000 because that was just what was processed yesterday. But as far as, you know, Brian, to follow up with the Trump administration.
Yeah, to be clear, we received, I believe, 16,000 applications yesterday, and they processed 7,000 of them and continue today. Our total number to date from last week is 28,000. And as far as the notice from the Trump administration, Workforce has not made us aware that West Virginia has received a similar request.
Okay, thank you, Stephen. Up next, Riley Phillips with WVNS.
Hi, this is Riley of 59 News down in Beckley. Can you hear me?
Sure. Go ahead, Riley.
My question is, can you just go a little bit into this drug that Mylan's working on? What does it do? What is it supposed to be used for?
You know, as a world, we are looking for possible treatments for this disease. And so hydroxychloroquine is a medication that traditionally is used more in the malarial world, but they are trying different medications that, in terms of how effective might it be. So this is one of the promising ones. And so they have, lovely, they ramped that up. We need to learn more about it. This has not been established fully in terms of all the clinical trials you normally do and established uses, but we are in a situation worldwide that we are looking for promising developments of treatments.
Okay, thank you, Riley. Up next, David Beard with the Dominion Post.
Hi, this is David Beard, and this is for the governor. You've talked before about using Fairmont Regional as a possible backup facility. The hospital would get overwhelmed. You were down in Fairmont recently to talk about WVU Medicine's 2 projects there that could bring about 35 beds in 32 months. Mon Health also has a project down there that they put in for, and I wonder if you would be willing to look into waiving their certificate of need, as you talked about waiving the CON for WVU Medicine.
Well, let me lead off by just saying this, that this question has got a lot of facets, but I'll be as quick as I possibly can. First of all, we've got to preserve our community hospitals. You know, I've said that over and over and over. The next thing is, you know, when I first brought up, let's get in the pipeline and try to utilize the fact that maybe a Fairmont who's got 207 beds, or maybe a Wheeling, or then maybe Sistersville, and that blossomed into Williamstown or Williamson, you know. But as you know, in the beginning when I brought that idea up, to be perfectly honest, you know, it's like, well, wow, I don't know if we can do this or not, you know, but if you don't dream big enough, you're not going to get it done. And right now, we've got, you know, the general working with the Corps of Engineers. We've got Congressman McKinley, and he's working it, and I'm working it as hard as we possibly can, plus everybody else here, because at the end of the day, and God forbid, we may very well have to use that as an overflow. Now, as far as your question with CON, you know, to be, again, straight up as I can be, I would welcome waiving the requirement in order to be able to get WVU in there tomorrow and get going, you know, but I'll have to pass to Secretary Crouch and everything to give you more detail on that.
We've looked at a way to speed up the process for Fairmont, the town of Fairmont, to get this decision made. The statute is very clear. The rules are very clear that were filed with the legislature, which gives them the force of law. So we have to follow that process at this point. I've tried to do what the governor said and speed this up, but some things are just not possible to speed up. So there's a process through CON that will go forward. The decisions will be made by the board of the Healthcare Authority, and we'll follow the statute where it's required. We try to speed up everything we can, especially right now, and we've relaxed a lot of rules throughout the department, and so you may see some of those things that we're moving on quickly, such as purchasing, that the governor was able to help waive with regard to the order, but some things don't fall under that.
And let me follow up on this. You know, I want you to give us again until tomorrow, and let me go back in the well here one more time, because in my opinion, you know, we're in unprecedented territory in every way, shape, form, or fashion, and some way, somehow, there's got to be a way. And so give me until tomorrow, and let me see if there can be a way, and if there's not, there's not, but I'm going to give it my best again.
Clarify, Governor, my comments had to do with the CON process on certificate of need applications that were filed. The issue of having an alternative placement for patients who have COVID virus are a different situation, I think, with regard to the governor's authority under the statute and possibly being able to do something there. So that's something we're exploring with a variety of facilities in the state or buildings in the state. So we're looking at that in terms of alternative placement down the road.
On the hydroxychloroquine, and that is that actually chloroquine and hydroxychloroquine are two medications that have been approved for use with coronavirus. There's some others that are investigational, but so there are some early potential treatments to use. There was some guidance sent out by the Board of Pharmacy this morning to providers around use of those. These are also medications that are really important for other diseases, so they are used in certain times of arthritis, et cetera, and so we want to make sure that those supplies really work for all the uses that are indicated. That guidance is on the Board of Pharmacy website and on our website for providers.
Okay, thank you, David. Up next, Annie Moore with WVVA.
I just wanted to check in on the test. How many tests are left? Are we in the process of getting more?
That's two questions. You know, our real goal, big picture, is to make sure that testing is widely available through the routine clinical diagnostic system in the state. So every day at the hospitals, they use their own diagnostic labs for testing and their own commercial labs for testing, and that's where it needs to be long term. So we need to be able to put the public health lab back in the function of meeting its public health mission, supporting outbreak investigation, disease surveillance, those kinds of case management, that kind of thing. So that's our bigger picture issue that we're really working on. And so we're reaching, in the meantime, we've had to fill in that clinical diagnostic laboratory piece. As you know, the challenge is there's not supplies nationally to fully do that. We do see both the commercial testing capacity gradually increasing. We are working with our hospital laboratories, clinical diagnostic laboratories, to have hopefully more rapid testing available locally in healthcare facilities, in terms of hospitals mostly, those level labs. And so we're reaching out to each of those to see what supports they need to get their own diagnostic testing ability up and running. At the state lab, we still are still at the situation of having limited supplies. So we are down to a few hundred that we can do currently, but we are also hoping for shipments of our extraction kits. We've been looking for other sources of those, the research labs, et cetera. They have not matched yet that we could do that with, but I think once we identify and get our shipment in, we should rapidly increase that amount. The other thing that we are doing is we are also purchasing new technologies that will allow us to run the test a different way and a little more rapid, a little larger volume. So those are purchases that are well underway, and we hope will be arriving as soon as we can have them. So I think there's lots of efforts underway. We have to recognize that as a nation, as a state, we're not going to have the laboratory testing that we might like to have. And frankly, though, you don't need to test every individual. We need to make sure that we manage this clinically for those that we can do that with. And then there are individuals that we want to make sure do have access to testing, and because they affect how we manage things otherwise. So those are our high-risk population, more likely, our hospitalized patients, and then it also helps on certain critical infrastructure individuals, to our healthcare workers, et cetera, to identify it in those situations so we can make sure they are both so that but we can get them well, of course, get back to work, but we know when it's safe for them to get back to work. So those are our priority areas.
Okay, thank you, Annie. Up next, Kara Lofton with West Virginia Public Broadcasting.
Hello, can you hear me?
We can.
Okay. Kara Lofton with West Virginia Public Broadcasting. I have two questions, to be honest, but I'll start with this one. We are hearing that some of the food pantries in the area have run out of food to feed their seniors and money to replenish, including munition, and also that food pantries are out of infant formula. What is being done to make sure that people are getting access to food, especially if they're out of work?
This is General Hoyer. So there were a couple of food pantries that provided information through the VOAD system of a need for food and donations. Those are being worked through the system and with the broader food bank piece. We continue to work those to address. I would encourage any food bank that has an issue to work through the larger food bank process and the VOAD system to get the information to us.
Okay, thank you, Kara. Up next, Kenny Bass.
Did you have a second question? Did you have a second question?
Am I back? I do have a second question.
Okay.
Yeah, so the Wuhan data showed that healthcare workers are more than 3 times likely to contract the virus as the general public. And Governor Justice, you mentioned that there was some worker initiatives to provide on-site housing. I know from sort of perusing social media pages, healthcare workers are really concerned about bringing the virus back to their family, either if they contract it or if they are a silent carrier. So do you have an update on that? Do you have an update on that?
Well, first of all, let me lead off, then I'm going to pass it, to Secretary Kraus. But that's something that we're working on, and maybe even Dr. Marsh can weigh in on that as well. But it's something that absolutely we should try in every way we possibly can to offer, because you're splitting the bullseye here. I mean, here's the whole thing. Our healthcare workers are the very, very nucleus of what we've got to protect. We have to protect it. And so with all that being said, then the next thing that follows right behind that is just as simple as just this, is as they're working on patients every day, the last thing on earth we need to have on their minds is the ability to maybe take that back to their family. Because all of these people have families and everything, and loved ones that they're really concerned about. And so we absolutely need to find a way to just solve that riddle, just exactly what you're just saying.
I can't say that any better than the governor did. Those folks are crucial to what's going to happen in this state in the next few weeks. If we don't have healthy healthcare workers in hospitals and nursing homes, in our local health care agencies and other healthcare providers, we're not going to be able to get through this. So, as the general mentioned and Dr. Slimp mentioned, we're working very, very hard to get more personal protection equipment into the state of West Virginia. We're doing that not just in this country, but we're calling other countries. We're looking at every source of equipment that we can find in terms of masks. We have shipments coming in almost daily, and we're getting that out to folks as quickly as possible. So we're going to prioritize our healthcare workers, and we're going to try to help keep them safe. Hopefully there is a situation down the road where we have more equipment, but we're pushing out what we have right now.
Also speak, we've had questions around what if I want to help volunteer? And we actually do have a system called WV Ready. It's the West Virginia Responder Emergency Deployment Information System. It is a system that is open to health and medical professionals as well as non-medical individuals who are interested in helping with health response. And so if you go to www.wvready, that's WVREDI.org, you can actually enroll in that system, and it works to kind of pre-credential folks and collect information that we could then link you with local groups of volunteers that could be of assistance throughout the event. So if we have either health and medical professionals or individuals that would like to volunteer, I would refer you to the WV Ready system.
Let me mention, this is Bill Crouch. The governor also mentioned housing for healthcare workers. Depending on how we move forward in the next week or so, it's possible we could use a variety of lodging for individuals who work in the healthcare system so that they do not have to return home. If they have an elderly person in their home, they have small children with problems, we're looking at that as an option, as well as looking at hospitals to actually place COVID-19 patients.
And Dr. Marsh, can you add anything to that? Is there anything going on at WVU that you may be able to add to that?
Governor, we're getting him back on the line in just a moment. He'll be here in just a second.
Okay, sorry, guys.
We're going to move on to Kenny Bass with WCHS.
Thank you. A couple of questions. The first one is self-serving with full disclosure. My daughter is a home health care worker. They've had great difficulty getting personal protective equipment. Many friends, close friends, are working in emergency rooms and emergency clinics. I know that 70,000 masks were supposed to be coming in today, with 100,000 are coming in, 30,000 going to first responders. What is, and you keep saying we're getting these masks out to people. How does that work? Do they call and request them? Do you guys have a list of people who've already made those requests? Is there a priority list of who should be getting them? So that's the first thing. And then secondly, we've had some complaints about state workers who've either had tests or believe they're infected with COVID-19. They get a test, they get the results back, they're going back to work, particularly in the highways department. So the second question would be, how closely are you monitoring state workers to ensure that they're not infecting other state workers because they have to be at the job because their jobs are essential?
So let me start with the first one, which is personal protective equipment. And this is such a critical issue. And so important for our healthcare system and for others in the community that for who would be at high risk, especially our healthcare workers. So the first, we received some supplies, federal supplies, and have sent that first batch out. Literally, it's happening as we speak. It is not, it's not the full amount. This is the beginning amount. And so it's being sent to local health departments. And it is meant, there's parts that go to hospitals, and then there are also parts that go across the healthcare system. So they work with their community, with their clinics, their home health folks, their hemodialysis centers, all of the kind of healthcare system, behavioral health, et cetera, in that EMS, in that community to distribute those supplies. And so that first shipment went out today. It will not be sufficient. We know there's more. It will come in chunks. We don't want to hold on to it here. So we wanted to get that first amount out. There's more coming in, as the general mentioned, and we will continue to send it out as it comes and work with folks to replenish supplies. So it's a beginning. It is not the long-term piece. It's continuing to, you will see more and more come, and as we get it, we just want to make sure we get it out. So that shipment today included a variety of things, some gloves, some face masks, some N95 masks, some gowns, those kinds of equipment. And there was a second part, Kenny, that you said, something else.
State workers who have concerns that their coworkers who are exhibiting symptoms or who have been tested without any results back are still coming back to work, and they're working in close quarters, they're not observing social distancing, and it's stressing a lot of them out. And they reach out to us about what we can do about it. We can't do much about it, so I'm wondering how closely that type of stuff is being monitored, particularly in the highways department. That's where we're getting a lot of complaints.
Okay, I don't know the specifics of that one, but I can tell you, this is why I give the guidance today, that if you think you have COVID-19 or you have been tested for COVID-19 and you're waiting your test results, you need to do the actions that as if you had it, definitely. And so that's why I was talking that if you've been tested and you're awaiting test results, or you think you might have it and you don't need to be tested, then you need to stay at home. And you need to do everything that you can to prevent spread at home and not go out in the community with that. And you want to do that until at least 7 days after your onset of illness, and at least 3 days beyond having a fever with that. And so that's really important, and you monitor your health, and if you get worse, you want to call and talk to your healthcare provider. If you are doing fine and get over it, great. But you've got to stay home with that. And so I think we have been, I know in our department, have been asking anybody and all employers to make sure that if they have individuals that come to work ill, they need to know about that, and they need to be getting them home. So anyone who develops symptoms that would be compatible with this illness needs to stay home and handle it as if they had it, and that is actually one of the prevention measures for community spread. So everyone can do something about this. If you've got symptoms that are consistent with it, then fever, cough, shortness of breath, even if it's mild, you can do your part by really, really isolating yourself and not going out in the community and doing everything you can to prevent spread within the household as well. I would refer you again to the information on the website about that. It's going to be a really important piece of disease prevention.
Okay, thank you, Kenny. We have Dr. Clay Marsh back on the line. Dr. Marsh, if you can unmute, we should be able to hear you now.
Can you guys hear me okay?
Yes, we have you.
Can you hear me now?
We have you.
Okay, very good. So I wanted to respond just to a couple things. So what the governor asked about, what one of the questioners was asking about housing for physicians and healthcare workers who may not want to go home. And we are starting to acquire some very close dormitory housing that will open up for folks at WVU. And we're also working with our hospital system that has identified some empty hotel rooms that could be opened as well. And previously, we have talked with Marshall University and with the osteopathic school, the West Virginia School of Osteopathic Medicine, and they are also very committed to doing that. I also wanted to make one other comment about the protective gear for the physicians. There's been a lot of recent information that helps us understand that when we are doing procedures that generate coughing or can create the aerosolization of the virus from somebody who's infected, then the very high the mask, the N95 mask, that block very well the virus from being able to get across to the nose and the mouth that can come from the air is really important. But more recent work from China demonstrates that if we have people wear surgical masks and use gloves and good hand washing, clean and disinfect the room around seeing patients that might have coronavirus, that seems to be highly protective. So it's a really important observation because the N95 mask, which are the very highly resistant mask that doesn't let any of the virus get across to the nose and the mouth, may not be necessary all the time for every person. And Massachusetts General Hospital just made an edict to all of their healthcare workers that they should have a mask on as they see people clinically. And the belief is from a lot of people in the community that the better impact of that mask is to keep people from moving the virus from some deposited place to their face and their nose and their mouth. So that just really reinforces the power that we all have, not only in the healthcare space, but in our normal lives, to be able to stop the spread of this virus.
Speak to around masks is there's been a wonderful, very West Virginia specific initiative around making masks and homemade masks, and I just wanted to speak to the fact that those are actually probably best used at the community level. So it might be helping some of those if it's needed by someone who happens to have symptoms of disease, that you want to make sure that they wear a mask if they have to be around someone, a family member or someone else. It might be used by some of our essential service workers who are out in communities that feel that they would like to have just some protection to remind themselves not to put their hands on their face, etc. So those are really probably a wonderful ability to use at the community level with that, and then that also helps to keep those those traditional medical surgical masks for our healthcare providers that are in higher risk settings.
Okay, thank you. Dr. Marsh, up next, we're going to go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, my question was regarding the president's comments today about wanting the economy and the country back open by Easter, which is far ahead of the schedule recommended by healthcare professionals. What would that mean for West Virginia?
Well, Charles, first and foremost, we need to give the president a lot of credit because he's made a lot of real good moves on the chessboard in trying to protect us from the standpoint of, not allowing flights to come in from Europe and China and all the different areas, that he's made good steps on and moved in the right way. From the standpoint of everything going back to a normal status and people going back to work and everything by Easter is ambitious, but at the same time, I would celebrate in every way, shape, form, or fashion if we could do that. I really believe this in my heart, and the best way for me to speak is just that way. I believe that there is a real possibility, of optimism here that this could some way, somehow pass if we continue to keep our foot on the pedal and doing the right things in the near-term days to come. It may very well be that I'm too optimistic and everything, but you've never met a person in your life that's more impatient than me, and I want to get things done, and I want goodness to happen, and I don't want us to slip into a situation to where we've got people that are petrified about their paychecks and how they're going to make house payments and everything else under the sun. So while I think it may be a little too optimistic and everything, I hope and pray our president knows something that I don't know, and we want to keep our foot right on the pedal and keep doing everything we can possibly do in this state, and let's just hope and pray this thing passes by us.
Okay, thank you, Charles. Up next, Brad McElhenney with WV Metro News.
Hi, sort of piggybacking on that question. I have seen in other media, national media, some modeling of peak spread, and I understand that we are trying to flatten the curve, but I wonder if you all, and particularly the medical professionals, have modeling that you're looking at that would show about when West Virginia might hit the peak spread of this virus.
When you look at these curves, and we can let Dr. Marsh and others kind of speak to some of this, we are very early in the curve, and we're kind of really watching to see when it begins to make that uprise. So you see it kind of level starting to increase. It typically will increase a little more exponentially, and then you begin to see, is it going to keep going up or is it going to be leveling off? And so I think we are early in that uprise, but we would expect the next several days to kind of get a sense more of what's happening with this. That's why we're watching the data so carefully and looking at those models. And then how much you can flatten that curve, it kind of extends it out. I'll let Dr. Marsh talk about some of those as well, but we are just in that early phase, but we're looking to how do we track that to know what we can project and where we are.
So this is Clay. Can you guys hear me?
Yes.
Okay, great. So, I think what Kathy said is right. So we know that if we follow the rate of positive tests versus the total number of tests, we have risen from the very beginning. but we are relatively stable, at least as far as yesterday goes. When we start to do the plotting, as the question was related to, then we are early in the pathway. You know, as we look at the very first part of the experience, what we find is our slope is more like Pennsylvania, which has a significant problem than like Kentucky that has done, you know, as our border state's done a good job. So I think that gives even more credence to the orders that were done yesterday by the governor related to shutting down non-essential businesses and also doing the stay-at-home order, because what we really want to do, as was previously said, is to continue to let the curve come down so it's not so high slope that comes down, but also so it's delayed. And California was able to delay their curve by the effects that they did. We would expect, as most states have done, about 7 days after our first case that we'll start to see the curve go up. We haven't seen that yet, and we're about 7 days today, I think. And so we'll watch for that, because the more days the curve does not go up, it tells us that we've pushed it out to the right, which means that we have bought ourselves much more time, given the things that we're doing now. So we're watching the curve, not only sort of understanding that we're going to get more cases, and at some point, you know, we're going to see penetration in West Virginia too. It's a pandemic. We can't avoid that. But if we're doing the right things, and our citizens are staying in their homes and washing their hands and, you know, and being careful about social distancing, 6 feet apart, then we can start to see the results of that with the curve as well. So the curve is not fixed, it's dynamic, and it relates to both the really good epidemiology that Dr. Slimp and DHHR is doing in cases like with our nursing home, but it's also related to what every citizen is doing. And as we've talked about, if enough people, 90% of people can do the right approaches, the social distancing, stay at home, wash your hands, keep your hands away from your face, then we may be able to flatten that curve significantly.
I really think you know, this is the factor that we can do all of the epidemiology investigation kind of things that we can, but what's important that will make a difference is that everyone in West Virginia does this. And so that is the important thing of following that guidance and those orders, and to really taking seriously the advice that we have been saying since the beginning: if you are sick, stay home. And, you know, treat it as if you were having this, and that will also help reduce spread.
Okay, thank you, Dr. Marsh and Brad. Up next, Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron from WSAZ. We know the community transmission is happening based on the nursing home, the Kanawha County Courthouse. Annex also had 2 cases. Employees who still have to go to work and are scared that they don't have any channel to safeguard their job post-pandemic and to protect their health. And I just wonder, to the people who are concerned about going to work right now, if their job is considered essential, what do you say to them? And is there any sort of recourse they might have, or anyone they can call to get guidance on what they should do?
Yeah. First, I say thank you. And that goes to all of my staff as well. You know, we have a lot of people that are doing this work when they have to be at work. They have also people that are doing the same work in response from home and from a distance. So we're trying to manage that as well. So I think it's really important. First, we say thank you. Second, that employers follow the guidance that's been sent out with essential service workers in terms of monitoring your staff, looking at their health. You know, making sure that staff know that if they do have illness, they need to stay home. You know, we are trying to, even with our essential workers, do as much as we can by remote distance or spread people apart. You know, it's very hard to adapt work sites, and I think we're all learning that still and trying to maximize it. We need to really take it seriously and continue to advance that effort.
Okay, thank you, Amanda. Up next, Phil Kabler with the Charleston Gazette-Mail. Phil, you might be muted.
Can you hear me?
Yes.
Got you now.
Go ahead, Phil.
All right, can you hear me?
We got you, loud and clear.
Modern technology. One of the questions, or one of the concerns I've heard today from people is that the number of essential businesses and services is pretty expansive. And will there be consideration at some point to narrow the number of businesses that are considered essential and allowed to stay open?
To answer that, Phil, we tried to strike a balance between maintaining essential services and protecting the public health. And in doing that yesterday, when the governor made the decision it was time to do this, we tried to look to not only the guidelines we'd gotten from the federal authorities at the Department of Homeland Security, but also to our neighboring states that had closed non-essential businesses and use that as a guide. Of course, this doesn't undo what the governor had previously ordered, and that was companies that could make do with telework and having reduced staff, that they keep that in place. So any company that had been doing that and then saw, well, I'm now not an essential business, I'll bring everybody in. That was not the intent of this, and it's clearly set out in the order not to do that. So, we've got to maintain those essential services. To the previous question about, there are risks in society, but people have to step forward and take those risks. Our life has to go on. We have to provide services to our citizens, and so we expect our employees to step up and do that. Private businesses have asked to be able to maintain their way of doing things so that they can provide those services that support our healthcare industry, our first responder industry, our infrastructure in this country. So we have to continue to do that, and the governor asked us to find a way to strike a balance, and I think we've done that.
Two, remember that just because you're designated an essential service doesn't mean it's always done in person. And I think that's what Brian is really speaking to with that. So, for instance, it's staying open in different ways. So we have our DHHR and enrollments and SNAP and other benefit enrollments. There's new ways to do that. Many of our healthcare providers, where they can, are shifting to telehealth initiatives and other efforts with that. And there's more information coming out with that for our providers, and 1135 waiver, et cetera. So those are all things that essential means you have to continue operations. If you can do it from a distance, if you can do it remotely, if you can do it in a different way, that's the best. If there are certain situations you have to be in person, and so you do those with as much protection as you can to folks.
Okay, thank you. And our last question today comes from Aaron Beck with the Register Herald in Beckley.
Okay, Aaron Beck, can you hear me?
Yes.
Okay, so we are up to 20 cases. We're up to 20 cases now that we are aware of. Dr. Splint, you have talked about how during the public health case investigative process, you investigators go out and they interview those people about their potential exposure, including how they may have got it, as well as who they may have exposed to the disease. You've also indicated that testing at the state laboratory has hindered that process. So I'd like you to elaborate on how exactly testing at the state laboratory has hindered that process. I'm not sure if that means workers at the state lab that would normally be doing those interviews are having to conduct tests instead. And I'd like to know for the 20 people, I want some idea of where we are in the process, those people. Do we know where they got it? Do we know, have their contacts been notified? Have their contacts been tested?
Right. So, and let me clarify. Our testing capacity at the state lab has not hindered case investigation or outbreak investigation. In fact, that would be the priority for our public health state lab. That is what we would like to utilize it primarily for. And make sure that the clinical diagnostic laboratories can do the other testing that's available. So that is actually our core mission through the state lab. So each of these investigations gets done locally, and we provide supports. And so when they do the investigation, yes, they have been going out each situation to find the individual, interview the individual, find contacts, interview contacts, get testing of those contacts. In fact, some of the cases that you're seeing rise in our numbers are actually from our contact investigations. And so you will see additional ones rise because of these. Some of those tests come to the state lab. We are always prioritizing those for our state lab. But you can also get that testing other places. So if you've got local testing in your hospital that can give you a strong, rapid turnaround time, then you can utilize that as well. So the key thing is in those contact investigations, you want to be able to have that test back and understand how to manage it. And what you do while you're testing that individual is you have them treat themselves as if they are positive. And do all the prevention measures that we talked about, and have their family members kind of stay home as well in case it is spreading further. So you actually manage it while you're waiting test results as if it's positive, and you do that testing to track it further.
The direction, just to understand, we've added an additional 18 personnel in the lab to augment the epidemiologists who go out and do this analysis as well. We have 2 data analysis officers as well as a medical doctor with a master's in public health who are going in to augment Dr. Slimp's team over there to help give her the capacity that she needs to do this work.
And each of those are actually coordinated at the local level by the local health department and the regional epidemiologist and the supports that the general speaks to.
Okay, thank you, Aaron. That is all the questions we have for today. Governor, back to you.
Well, let me make 2 or 3 comments about all of our questions today. They've been great. I want everybody here to understand just this, that I meant it when I said that I'm probably the most impatient person that maybe you've met. Our people are doing great work, and we should salute and commend them in every way. But I would tell everybody that it's my job to push them to do better. You know, there was a question about the Fairmont CON, and I know we have to follow guidelines, and we will. But the answer really and truly is just, I mean, the final answer may be exactly what it has to be and what it's already, what Secretary Crouch already presented to us. But it doesn't mean that I'm not going to go back and try to change the answer, because, you know, I've got to tell you this. I would like, if I had the opportunity, and I'll sure make the time for me to do it, but, you know, from the HIPAA laws and the fact that people are sick and everything, you know, I surely haven't been able to speak with all those that have had a positive test. But I did have the opportunity to speak to one gentleman in the ICU unit. And you could really tell, I mean, this man has been really sick. And he felt like that he was really at one time close to losing his life. And if you had been on that call, you would feel exactly how I feel, in that we got to do everything in our power. We've got to catch 5 extra gears to try to do everything in our power and then some to be able to assure our people and help in every way possible. I don't mean that in any way, you know, to toot my horn or anybody's horn. You know, it's just a matter of just simply this. We don't rest until this is over. And I want to say one other thing, too. That gentleman wanted me to be sure to pass the accolades on to his doctors and on to his head nurse, because he felt like unequivocally they saved his life. Now, does that not tie completely to the fact that we need to protect these healthcare workers in every way, shape, form, or fashion? And there was a question, too, about, well, you know, are the masks or the protective gear, and they're not getting out fast enough. They're right, you know, and we need to absolutely do more and more and more. you know, I can surely detect the frustration, but I'm frustrated too. And I'll promise you that, that I'm pushing everybody beyond belief. I've got to tell you just this story real quick. You've heard me say this before, but when I was a young kid, I stood in front of my dad's desk, and this is all I could think about when these questions were being answered and this was going on. My dad, I stood in front of his desk and said, Dad, I don't have any idea what it was about, but Dad, there wasn't anything I could do. And when I said that, the desk exploded as he jumped across the desk and grabbed me by my shirt, slammed me down on the desk and said, Dadgum you, there's always something you can do, and you better dadgum always remember that. Well, that's how I feel. I mean, that's exactly how I feel. We have a full-fledged pandemic. The biggest and most important thing that has ever happened to any of us in our lifetimes. Just because we have regulations on a CON that can't be done, or just because we have masks that we haven't gotten, it doesn't mean we stop, you know. And so I can just assure you in every way, I thank our people beyond belief on everything that they're doing. They're doing fabulous work, but we're not going to rest till this is over. That's all there is to it. So I thank everybody, and God bless everybody that's doing all the great work. Thank you again.
Today's media briefing has concluded. Thank you.